Good afternoon, everyone. I'm here with Dr. Joseph Nemeth,
Hi there.
The living legend, the YouTube sensation, and we get just so many comments and so many questions from you guys, so we wanted to do a live stream so that we could personally address some of your more pointed questions that you might have for Dr. Nemeth. So first and foremost, how are you doing today, Dr. Nemeth? You feeling good?
I'm feeling peppy and great and eager to spread the word about what we can do for people and help them get healthy.
Absolutely. So without further ado, I just want to jump right in. Let's start looking at some of the comments that we've gotten on some of our YouTube videos we posted in the past.
Okay.
And start from there. So Sarah Khan says, "Hi doctor, I had periodontal disease."
You mean Sarah? We don't mention last names.
True.
So let's just mention first names.
Sarah had periodontal disease. It's been 18 months and her gums haven't bled. Does that mean that it's improving? And also she wants to know if she can start going for braces.
Read that one more time to me.
So she's saying that she had periodontal disease.
Right.
But it's been 18 months and her gums have not been bleeding.
Okay. Has she had any treatment? We don't know if she's had treatment. She hasn't had treatment.
Mm-hmm.
If she had periodontal disease and she was not treated for periodontal disease, it's very likely that she still has it. Simply because the gums are not bleeding does not mean the disease is gone, because some of the newer toothpastes have chemicals in them, agents in them that target organisms that cause bleeding. But that doesn't mean that that material gets down under the gum and therefore it can't kill the parasites and bacteria that are deeper under the gum. So chances are there's still disease activity even though the bleeding is no longer apparent.
That's great. So we got another question. Someone named Joel was asking one day ago, is there a way to reverse gum disease once it's gotten started?
Reversing it is difficult. Stopping it is not so difficult. So usually, depending on how advanced it is, in most cases, my feeling is gum disease can be stopped and the teeth can be saved. But again, it depends on how severe it is, how much damage has occurred. If a tooth is very loose and maybe only 10% of the tooth is left in the bone, the outlook for that tooth is just not good, because it's probably beyond the point of no return.
Mm-hmm.
Reversing gum disease means getting the gum and the bone back to what it was. That's very rare. Impossible? No. Rare? Extremely.
So, on our video, we were showcasing how to keep your gums and your teeth healthy during quarantine. And one of the ways that we list doing that is hydrogen peroxide and water rinses if you're having some bleeding, getting some oxygen into your mouth so that it can help create an environment where that bacteria doesn't grow as quickly. Someone is saying that in our video, we show that you want to do a 1/4 cup of water and a 1/4 cup of hydrogen peroxide. And they're saying that the proper proportion they've heard in another one of our videos is 3-to-1. So what would you say is a better ratio? Is it half and half, or is it 3-to-1?
I think that 50% dilution is probably more effective. So half and half, probably slightly more effective. On the other hand, it's stronger. And because it's stronger, I'd be more reluctant to use it on a daily basis, because there have been cases of what's called, and this sounds disgusting, black hairy tongue. And there we can get an overgrowth of fungus or certain organisms, and that has been seen when hydrogen peroxide is used on a daily basis, particularly a stronger version of it. So occasional use, 50%, more frequent use, probably 3-to-1.
Okay. Great answer. So we're getting some questions live coming in. Rudy, how you doing, Rudy? He is asking, how effective is laser treatment for severe gum disease?
I think it's extremely effective for severe gum disease. I think it's more effective than traditional surgery, because when you do traditional surgery, you're actually lifting the gum, cutting away some of the gum tissue, which then I think actually makes these areas more difficult to keep clean, creates sensitivity. And every time you lift the gum tissue back away from the bone and expose that bone, you're actually losing a little bit of bone. So if you're already critical and you expose that bone and a little more bone is lost, that little more bone can make the difference between saving the teeth and not. And my own feeling is the more advanced the gum disease is, the more LANAP or laser treatment is preferred over traditional surgery.
Absolutely. So we've got another question coming in. Have you ever heard from Jacqueline? How are you, Jacqueline? Have you ever heard of taking someone's own blood and mixing it with bone material for an implant?
Absolutely. It's not unusual to do that. I think it works a little bit better if you mix whatever bone grafting material you're using with the patient's own blood. It seems to be more accepted by the body, and the bone replacement material is more readily replaced by the body's own bone when you're using the patient's own blood as a vehicle to make a paste or a mixture out of it.
Very interesting. So I've got another question here. Someone is asking, Robert, how are you today? Thanks for joining. Is oral irrigation better than flossing?
Difficult question. If I had to choose between one or the other, I would probably choose flossing, although I prefer these interdental picks to flossing myself. But water irrigation is extremely important. I believe it's critically important. So flossing or these picks between the teeth will remove the film that collects along the side of the tooth very effectively. The water pick flushes out food particles and is not perhaps quite as effective in removing the film. But as far as I'm concerned, both are really, really important. Flossing or picking between the teeth with small interdental devices and a water irrigation device. I'm in the process of testing a number of water irrigation devices. There's something called the water pick, which is commonly known. There's something called hydrofloss, and now I believe it is the Sonicare company has just come out with a water irrigation device, which we had a preview of yesterday, actually.
Yeah.
Water irrigation devices are very important. I use it 2 or 3 times a day myself, and I wouldn't want to be without it. If I'm traveling or I'm in a situation where I don't have it available, of course, then you only have floss or the little picks to clean between the teeth. But
exactly.
Cleaning between the teeth is the key. Water pick, water irrigation device, I don't like this water pick because there are many irrigation devices, is extremely helpful, but cleaning between the teeth with actually a tangible device like floss or a pick is essential.
Yeah, and based off of what you've told me before, it's kind of the key is a combination of things. You want to floss and use the water pick consistently because they both clean in a different manner, and for the most effective, thorough job, you want to combine these things.
Absolutely. And every time I use that water pick, I use it on the highest pressure. My mouth just feels better, and it doesn't take long. I can do it in 25 seconds on high pressure just after I eat. If I'm home, just flush all that food particles out of there, and it's amazing to see what comes out that you don't even feel or aren't even aware of.
I've experienced the same exact thing with my water pick at home. So we've got another question coming in here. Someone is asking me to ask you about their hot bad breath, and when they scrape their tongue, it's still white. They went to the doctor's office and they told him that it's not a yeast infection, and he says he's tried everything. And he asked in a separate question, ask him how he might be able to find the root cause of this problem because it's been happening for years and they're really suffering from this.
What does suffering mean? If your tongue is white, that doesn't necessarily mean you have bad breath, it doesn't necessarily mean there's an infection. It means that your tongue has a whitish appearance, and it's possible that there may be some sort of organism, totally harmless, not causing a problem, that's very difficult to remove, and that causes the white tongue. You don't know if you have bad breath just because your tongue appears white. The only way to know is to really get tested or ask a third party, because people can't really tell their own bad breath, much as they are often very sure they can. They can't.
And you've mentioned to me before that a lot of people that come in that swear that they have bad breath and they want to get it treated actually don't. And then the people that have the worst breath,
Right.
they have no idea.
A huge proportion of people who come here for bad breath treatment, we are not, actually don't have bad breath. They're convinced they do. It's almost impossible to convince them that they don't, because they're very heavily invested in that.
Absolutely.
And so, you know, we explain to them, they test negative, we check their breath. Actually, we even smell their breath. There's no evidence of it. But, you know, people believe, and when someone believes very deeply in something, as you know, very hard to dissuade them. And so very often we'll treat these patients just because it helps them to feel better, even though they really haven't had a problem. Not that we could discover
More
anyway.
of a psychological problem than anything.
It's their perspective of the situation.
That's, yes.
We all have psychological problems to one extent or another.
That's very true. Okay, so someone is asking, Tracy, how are you? Thanks for joining. What is the best way to research a good dentist in your area? Is there through word of mouth? Are there any sites that are particularly helpful?
Well, it's difficult. Probably what I would do is contact the office of a dental specialist, perhaps a periodontist, because periodontists have to work hand in glove with general dentists, because they have to prepare the mouth for the general dentist to do his work. So if there's a periodontal office in your area, or more than one, I would contact them, ask them for recommendations. Also, if you know someone who you respect and whose mouth looks and feels great, you can ask them who their dentist is. So those are two common ways. It's really hard to know. You know, dentistry, you know, a lot depends on, people think that because your dentist has a great personality and he's gentle, that he's a good dentist. They don't necessarily go together. Sometimes dentists may have a cold, you know, personality, something that you're not comfortable with, but that same dentist may be meticulous and very, very thorough and good at the dentistry he does. So can't go by personality.
Absolutely. And you know what I will say is I've done a lot of research on specifically in the periodontal field, LANAP and the pinhole treatment for gum recession. Their websites actually have a portal where you can find a LANAP approved dentist or a pinhole approved dentist in your area. So at the end of the stream, I'll put those links in there. So if you're looking for those specific services, their portal might be able to help you. However, if you're looking for something a little bit more in the general dentistry field, I think Dr. Nemeth is right. It probably would be best to do some Googling and some research to try and hone in on that.
The problem with the pinhole approved dentist is that means they've taken the pinhole course. It doesn't mean they're experienced in using the pinhole.
That's a great point.
And let me tell you something. The learning curve for the pinhole is infinite. I was among the first in the country to take it. And you never stop learning. And simply because you've taken the course and you've done a case or two cases or three cases doesn't mean you can get the kind of result that really might be obtainable with someone who has more experience and has learned basically, you know, from trial and error what really works.
All right, so we've got more questions coming in. I'm going to try to get around to as many people as we can. Someone is saying that their gum tissue feels like a stone in the area that they just got an implant. Is that normal? This is Robert's question. Great question, Robert.
Well, when you have an implant, some of the fibers, the nerve fibers in the tissue in that area are cut in order to allow the implant to be placed. and it's possible that manipulation of the tissue, cutting of the tissue, may have cut some nerve fibers that will regrow most of the time. Sometimes the numbness or the stone-like feeling is permanent, but majority of the time, eventually that fades and no longer is noticeable.
All right. Someone else is asking, what is the best place to go to for a dental implant?
I think you want to go to somebody who's done a lot of dental implants, and my own feeling is periodontists who are very generally tend to be very meticulous and thorough is a great place to start. Oral surgeons do implants now, even endodontists can do implants. But you know, I like to think. I'm sorry. I like to think that periodontists overall do a great job. General dentists can do implants. You know, you just never know. But if I had to start, I would start with a periodontal office.
Absolutely.
I'm not sure I understand.
And from what I've seen, Dr. Katranji, who's here at this office, does an amazing job with All on Four. I mean, some of the before and afters I've seen of his dental
in our
implant
office
cases.
here, my partner, Dr. Katranji, is unmatchable in my opinion. I think he's the finest implant periodontist in this part of the country. Really, he's
I didn't get that.
great.
Could you try again?
I think Siri is listening in on our conversation.
Sure thing.
So, I've got a couple more questions here. So, someone is asking, is it safe to use baking soda in the mouth if they're suffering from gum recession? And should they use baking soda before or after they brush their teeth with toothpaste?
Well, it depends how you're using the baking soda. I wouldn't brush with baking soda. There's an abrasiveness to anything that you're using, including baking soda, and anything that's abrasive can contribute to notching or wearing away of the root surface or the tooth surface, as well as increasing the risk of recession. So I would not use baking soda for brushing unless there's some special need or indication. You can use it between the teeth where recession is really not a particular problem. But on the front surface, the outer surface of the teeth particularly, the harder you brush, the more you brush, the more abrasive you brush with, the more likely you're going to be causing recession or make the recession worse.
And I think that kind of hits home on a lot of these questions that Joel is asking in the chat. Earlier on, Joel, you were saying, what's the best toothbrush if you're wearing your gums down? You know, more recently you said, what should you do if one of your teeth gets down to the gum? I think what he's referring to is having some gum recession, maybe on one particular tooth. What might you say to Joel about his situation?
Well, if you have gum recession, whether it's on one tooth or two teeth or three teeth, you have to be careful, because if you scrub it hard, you're likely to cause the recession to get significantly worse. Studies have shown that once recession starts, it tends to progress unless something is done to stop it. So you really want to not traumatize the tooth. You do need to clean it. A soft toothbrush, brushing gently but thoroughly, is the way to go. And on the lower teeth, brushing upward, on the upper teeth brushing downward, so you're almost trying to bring the gum up on the lowers and bring the gum down on the upper teeth. Might be something to consider, but it may be at a point where you need to do something to stop that gum recession and try to cover the root again, which would be, in my situation, I use the pinhole technique.
Absolutely.
For treating gum recession. It's very, very comfortable compared with the traditional grafting method from the palate, and is very effective.
Yeah, it's extremely effective, and that is when someone gets to a point where it's either causing them discomfort, sensitivity, and it's really getting worn down. But there are some things that you can do at home, and we have a video on our YouTube channel where Dr. Nemeth goes into great detail about 10 different things that you can do to minimize the recession that you might be facing. So Joel, I hope that that was helpful and that that answered your question. Someone is asking a little bit more about the bad breath treatment and the cost. So essentially it happens in two parts. There's the testing, where we make sure that people really do have bad breath in the first place.
Exactly.
And then afterwards is the treatment portion, because you'd be surprised how many people come in and when we test it, they really don't actually have bad breath, but they think that they do. So at that point, they can decide whether they want to move forward or not. So it's essentially a two-part treatment.
Exactly. The testing, you know, I'm believe it or not, I'm kind of embarrassed to say this, but the testing, I think, runs around $200 for the testing. And if the total treatment, including the testing and the bad breath treatment, including any follow-up problems, comes to close to slightly under $2,000.
Yeah,
I think,
when it's
now.
all said and done, it's just under $2,000.
Yeah.
And we've had people travel from, we just had someone in from Hawaii, right? Just
We
last
did.
week. Yeah. We've had people from all over the country, all over the world coming here to get their bad breath treated, and they've just been so happy and they've been raving about it.
We've had a gentleman from Bahrain come, people from England, Korea, yeah, Michigan, of course, but probably more from the 49 states outside of Michigan than Michigan itself, which
It's
is
funny.
interesting. Of course, that makes sense. There's 49 times as many states. But anyway, we have people from all over the country and all over the world coming to us to have their bad breath cured, treated and cured. And believe me, it's a miracle.
I didn't get that.
You have
Could you
your
try
bad
again?
you have your bad breath, and we treat it, and the next morning you don't have it, and you never have it ever have it again, as long as you do what we ask you to at home.
Yeah, and a lot of people will do that. And the other thing that is, people ask us, why don't we have more testimonials from our bad breath treatment?
Yeah, I think bad breath people don't want to talk about the fact that they have bad breath.
Yeah,
They're-
that's the main
They're just
thing.
not comfortable with it.
We get tons of people that are super happy with the treatment, but they might be a little reluctant to get on camera
And that's
and
exactly
talk
what
about it.
happened with the patient who was here from Hawaii. You know, people don't want to brag about their bad breath, even if we've cured it.
This is true. So someone is asking, we had that one video about the gentleman that maybe bit down on his lip and it caused that big mucocele, that big cyst. And when we did that video, it taught me a lot about the glands and the different type of salivary ducts that are in the mouth and on the lips. And someone is asking here about swollen lymph nodes and glands, or if there are any glands or
have an answer
lymphs
for that.
in the upper
Is there
gums
something else I
that
can
sit
help
on the
with?
lips and are along the deep gum line. So
I didn't get that.
do you
Could
know
you
of
try
any
again?
do you know, that's a new watch, right? Do you know of any of the glands and lymph nodes that are in the gum tissue that may be contributing to any sort of disease or recession? Do those play a factor, or is it other things that may be more important?
Glands, that sort of thing. There are oil glands, there are salivary glands in the lip and the cheek. I don't believe they have any relationship with periodontal disease or gum recession. They can be annoying because if they get plugged up, then that area will swell and then it may burst. But as far as I know, it's really not dangerous. And to the best of my knowledge, I've seen nothing in the literature and experienced nothing that would correlate gland problems in the lip or cheek with gum recession or gum disease.
Another person is asking, we have time for a few more questions, so anybody who's in the chat that hasn't had a chance to get their question answered yet, we're going to answer just a couple more. Someone is asking, what's the longest that someone has gone without brushing their teeth that you've seen in this office?
20 years.
20 years. I don't know. I couldn't go more than 2 days without feeling like I was going crazy.
You'll remember that case we had
Yeah.
where you couldn't see the teeth because it looked like you walked into one of the caves in Kentucky with stalactites and stalagmites because there was so much tartar and calculus on the teeth that the teeth were completely obscured. The patient had not brushed in something like 20 years. And of course, the patient's breath was horrible. He was on the verge of his wife divorcing him. And we did a miraculous, or we were able to help him accomplish a miraculous turnaround. And we got rid of all of that tartar, got rid of the bad breath, and put him on the road to good health and hopefully a happier relationship with his wife.
Yeah, I do remember that case vividly. That's one of our most viewed videos on our channel, is the gentleman who didn't brush his teeth for 20 years. And gosh, I wish we had the camera running when they were going in there and chipping away at all the calculus. That would have, the next time we get a case like that, believe us, we're going to make sure we get the whole thing on video. So,
Well, my watch was making that noise.
yeah, what was it doing?
Apparently Siri on my watch was trying to understand what we were talking about, and it kept interrupting.
It was interrupting.
So I now have Siri on airplane mode, and maybe Siri will keep Siri's mouth closed and we'll be
perfect.
happier and undisturbed.
Yeah, thank you. Okay, so someone is asking, can gum disease and gum recession be cured?
Well, I believe it can be. It doesn't mean that the destruction that's occurred can be regenerated. But if you can stop the infection, one might consider that a cure. And when I talk to patients, I tell them, I believe we can stop the infection. We can call it a cure so the disease is no longer progressing. However, if the patient doesn't do their part at home, that disease will come back. So cured does not mean permanently cured unless the patient does what they need to do at home.
Absolutely. Someone is asking, please, please, please. So, Solid Wolf 34, I got your question next. Why isn't tongue scraping talked about more in the dental community? It seems like it's going relatively overlooked.
It is, because I just don't think that most of the dental profession and the dental community realizes the importance of tongue brushing, particularly for bad breath. So, hey, I don't have any answers. I just know that when it comes to bad breath, tongue brushing and cleaning the tongue is beyond important. It's critical.
It absolutely is. I couldn't agree more. And we have time for one more question. So we are going to take Robert. Thank you for asking. Can gum disease cause diabetes or another disease?
Let's put it this way. Can smoking cause lung cancer? They've never done a study to prove smoking causes lung cancer, but I think we all know that if you smoke, you're much more likely to get lung cancer. And it's the same thing with gum disease or periodontal disease. We know that if you have periodontal disease, you're much more likely to get diabetes, and your diabetes is much more likely to be worse if you have periodontal disease. Periodontal disease is linked strongly to Alzheimer's disease. It's linked to almost every cancer. It's linked to lung problems. I mean, you name anything wrong with you, diabetes, heart disease, stroke, lung problem, anything is linked to periodontal disease, and you're at increased risk for almost any systemic disease that I can think of. I think there's more than 50 conditions that you're more likely to have if you have periodontal disease, because the bacteria, the parasites from gum disease, they don't just stay in your gums. They get into your bloodstream, and they travel to your brain. They travel to your heart. They travel to your lungs. They travel to every place in your body, making that unhealthier. So, hey, that's why I always say you can't be healthy if your mouth is not healthy. It's simply not possible.
It is. You're right. And that's been your message all along since we started this channel about 6 years ago.
Yeah, it's totally my message.
So
save your mouth, save your health.
Absolutely. One more, if you don't mind. Kendra has been begging.
I'm thinking of minding, but let's try it.
She seems like a concerned mother. We're going to address your question, Kendra. She asked it in multiple parts, so I'm going to try and piece this together. She is a 15-year-old, and she's asking why a dentist would say that her 15-year-old has an infection on the upper gum, back molar, next to where the wisdom tooth was, but then it resolved itself by the immune system, quote, doing its job. Then she's also saying they got a second opinion. He said that the gray area near the root, which is a healthy tooth, shows that the immune system fixed the problem. That's where she started talking about the lymphs or the glands that live in the upper part of her mouth. She has one deep upper mouth above the wisdom tooth number 6, and there's no infection, just some weird gland. Please answer my question about my daughter. I'm so confused how the deep root near the sinus healed on its own. I guess maybe because removing the tooth behind it allowed it to fix itself. She's just curious if you might have any thoughts on that.
Yeah, there probably was a pocket between the wisdom tooth and the tooth in front of it. And once the wisdom tooth was removed, that pocket was able to be kept clean. There wasn't an area between two teeth that was very difficult to clean. So the wisdom tooth's taken out. Then the area behind the tooth that is still in place can be cleaned more easily, doesn't trap food, and therefore you can call it the immune system. It's not the immune system. It's just that area is no longer compromised by being caught between two teeth, and so nature just enables it to be kept cleaner, and the swollen gum tissue or inflamed tissue between those two teeth just shrinks, and it then becomes healthy.
That seems like a relatively good problem to have, if you ask me. It fixed itself. You didn't have to go in for some expensive treatment.
Well, he had to have the tooth removed, or she had to have the tooth removed, which, but yeah, the fact that it's healthy now, the bottom line is, hey, great, the wisdom tooth is out. That was the problem. Now the tissue looks good, no bleeding, and hopefully that tooth will be kept for another 120 years.
I feel like I learn so much from you every time we do one of these. It's such a blessing to be able to be with you and to do something like this. And we're going to do a lot more of these live streams in the future, perhaps once a month. Or if you have any suggestions, we're going to do a poll on our YouTube channel where you can weigh in and let us know if you think there's areas where we can improve or how frequent you want us to do this, because I love the live element. I like, answering questions for people, and I truly think it's really valuable for them.
It's valuable for me. I like to know what people are thinking, what they're wondering, and it helps me to address some of these things, not just during this forum, but perhaps do separate videos on them at a future date.
Absolutely, yeah. This could spur on a lot of different ideas for how to, your questions could end up in a future video one day on our channel. So this has been hugely valuable.
Yeah, so thank you all for the questions. I do appreciate it, and I'm sure the audience does as well.
Yeah, absolutely. We appreciate you guys. Don't forget to subscribe to our channel. We're going to be doing this probably once a month, maybe once every 2 weeks, depending on the demand. So keep your eye out for a poll from us, and we'll start to get some more information from you guys. But like Dr. Nemeth says, remember, if you have a healthy mouth, you'll have a healthy body.
Thank you, Skylar. This was a great idea.
Thank you.
It was your idea, and assuming I don't get any threats, we will do this again.
We absolutely will. Take care, you guys. Have a great day.
You take care.